Hi, my name is Angie Morales and this is the final exam of the video Neuroscience of Speech Language Pathology. My idea is based on showing us why speech therapists and audiologists need to have a neurological basis of speech and hearing, and that this originates in the brain and the auditory component that is found in short as we know that Broca and Wernicke were managed to locate parts of brain responsible for the speech functions. Academic concept is to demonstrate how the brain is divided by certain areas and functions. This can help us at the work level at the time of begin with patients and be observing certain patterns of behavior we feel a possible lesion in the brain. Yes, it is important, as I mentioned before, knowing the brain in detail can help us to be more assertive in our diagnosis and therefore in the intervention process in order to always seek the communicative well-being of the user, as that we begin to have a different idea of what the brain is and how it works. At an interdisciplinary level, we will be able to collaborate with our colleagues and actively participate in the health of the users. The main idea is about what is mean disease symptoms that is has, for example, that patients with this disease usually have an excess of fluid that begins to accumulate into endolymphatic chamber. Where this happens, tinnitus and oral fullness, or in other words, felt whistlings in the air or sensation of clogged hair, and crack is generated and mixing between liquids, giving way to vertigo or dizziness symptoms. It is resorted and the symptoms go away but may recur. The doctor gives us certain instructions such as avoiding salt, alcohol, among others, and also that there is a surgery that can help. The academic concept is to explain how Meniere's disease looks like internally, certain aspects showing us internally the symptoms, the accumulation of fluids, also in the area of surgery, to explain and show how the procedure is performed and some medication that help in this process. Yes, it is important to take into account the symptoms when treating a patient. Also in this intervention, how the process is generated, I can evaluate different criteria that will be fundamental, and this is necessary for the user to go through a surgical procedure or can be treated with medication. Also take into account that it might be better for him, and as always ensure they be welfare and quality of life. Thank you very much for your attention.